Deneen?
Deneen Micheletti, representing the California Alternative Payment Program Association. Thank you, Committee Chairman McCarty and committee members for having this hearing. So I'm going to talk today about alternative payment funding and additional investments. So it's important to understand that everything that you've heard today, that slots are at 2005 numbers, family incomes frozen, all of that impacts directly alternative payment programs. And the reason is alternative payment programs are funded based on the monies that go out the door in terms of provider payments. So as you just heard, a provider who is paid, a license exempt provider paid $420 a month, we get 17.5% of that to operate the entire program. So what's going on in the field? We're imploding. Agencies right now, because money is only funded on what goes out the door in terms of provider payments, and those are for eligible families, what we know is 23 to 62% of the families that come through our doors seeking child care do not complete the eligibility process or are ineligible. So that means that all the work that the agencies do up front goes unfunded. From the time that the process begins for a family, it takes 30 to 90 days before an actual payment is made for an eligible family. All the work leading up to that goes unfunded. Coupled with that, since 2008, over 150 separate management bulletins or required changes for agencies have been required of agencies to implement. I'm going to point to a specific point in time where alternative payment programs imploded, and that was October 2010, when Governor Schwarzenegger blue-penciled Stage 3 funding. Overnight, this was in October, overnight 54,000 families were thrown off of child care. 54,000. So what I just told you is that agencies are not funded for any work that does not generate a payment. From October 2010 until mid-January, our agencies had to send out a minimum of 5 communications to 54,000 families. Overnight, caseloads surged. We were seeing, and where we have now, we have 1 caseworker on average to every 185 families. What that means, and so I'll cover that. What else is going on is that we thankfully appreciated last year that there was a restoration of rates and a restoration of child care slots. But please know that every time that there is a change, it is a cost to the agency to implement. For the child care rates were increased in July of 2015 and in October of 2015. Both of those rate changes required agencies to change their data systems, again at a cost. What additionally happened is because the rates were changed and it hadn't been planned for accordingly, most of the agencies had to go seek bridge loans because we simply didn't have money funded in our programs to cover the costs of the rate changes up front. And again, those are costs, and instead of costs, you may want to think those are child care slots that are not going to be funded. We have a finite amount of money in the system. So because we're not planning to implement changes, those are slots that are going unfunded. What also happened in October 2010, when those 54,000 families were cut off from child care, Governor Schwarzenegger reduced from 19% to 17.5% the amount of our agencies to function. We never got that 1.5% restored, yet the workload impacted for each of our caseworkers imploded incrementally. So the unintended consequences that we have now is the caseworkers, when you have 185 families, I can guarantee you that the caseworkers do not have the time to educate the families and connect them in a real way to these quality environments of preschool and TK, the families are not getting the information. So the CalWORKS families and our working poor families are being even further separated from our existing system. So earlier, when we talked about funding for LEAs, unless you have in a real way the connection where the families that we serve get information in a real way connected, the CalWORKS families and our poorest families are not going to get that information. Agencies are experiencing an extremely high turnover with staff. Agencies who are eligible and come through our doors are with our agencies on average from 4 to 7.3 years. The 12-month eligibility is a great thing. Technically in California we have it, but we have a lot of requirements. But let me underscore that moving to a solid 12-month eligibility and eliminating some of the burdens on reporting is not a cost saver, nor should it be looked at as a cost saver. The funding, any reduction in administrative burden, keep it with the agency and additionally add to it so that you can bring down your caseworker to family ratio to manageable levels. If we want to really improve the lives of these families, we need to make sure that caseworkers can connect them to quality environments, support them with wraparound care. Technology and infrastructures have suffered. Again, APs are solely funded on the monies that go out the door, so there's no funding for improvement of technology or computer systems. We have legislation last year and this year going through allowing agencies the option in the future to realize savings by moving to a paperless environment. We have no upfront costs to get that implemented. So moving forward, making investments. Again, we need to increase the funding for the agencies to get those caseloads down. We need to make sure that the agencies have the funding to educate the caseworkers about supporting families in a real way that makes a difference. The families get their information from the alternative payment programs. If you want to get these families self-sufficient, that's where you've got to get the funding to go. We also need to fund a centralized eligibility list. We've had a centralized eligibility list in the past. It was with the alternative payment programs, and preference was given to those alternative payment programs that were co-joined with a resource and referral agency. It's important to know if we're even scratching the surface of the need in California. We know when the centralized eligibility list was defunded, about 200,000 families languished there. I would say it's far and above from there. Again, California, we have a 40-year plus rich alternative payment program delivery system. It has the capacity, we've seen it before, to do a lot more. I think if we invest in it, the families that we serve will be better served and more self-sufficient. Thank you.
Thank you. Erin Gable.
Erin Gable on behalf of First Five California, and in my remarks today representing the Early Childhood Education Coalition. And you're hearing a reoccurring theme today from each of the panelists that I share the table with, and that is in another budget surplus year and as part of an historic economic recovery, that it's absolutely necessary that we need to prioritize now the rebuilding of our early learning system, but realizing that we're doing it from a place of incredible deficit, infrastructure deficit, access deficit that has a direct impact on our children and families, and this deficit has to be addressed in a significant way over multiple years in order to rebuild a system. The Early Childhood Education Coalition supports the Women Caucus proposal for a significant $800 million investment in the current budget year as part of this multi-year plan to get to the system for early learning that the Golden State and our children deserve. Reform discussions are healthy, but you can't discuss repairing the pipes of your house when your foundation is crumbling and there's no water in the pipes. So to quote the governor from his January budget release, we believe it's absolutely crucial that we address the infrastructure of the system to rebuild a healthy system. The Early Childhood Education Coalition letter is not exhaustive, but it is a priority list from a shared perspective from the advocates we had at the table. First 5 county commissions, including the state commission, early learning professional service providers, early learning advocates, and chambers of commerce from around the state. If we are looking at a comprehensive effort in a single year to start tackling the major infrastructure issues we have to quality access, much of which you've talked about already at the panel, so I will just touch on those briefly and try to provide a little bit more emphasis on those if we didn't cover them already in the panel. First and foremost, with incredible underlining, is the rates issue. So you've heard it from a number of our folks on the panel today. We need comprehensive rate increases in order to address the necessary need for meaningful per-child funding for the system. It's tied to everything in terms of quality, professional recruitment, professional retention, the quality of the child-teacher interaction that happens in each of those care settings across the state, which is the most influential on the lifelong impact of that child being in care. So we absolutely urge, first and foremost, before looking at anything else, we look at rates. Then we move on to slots. If we've adequately raised our rates, we can then talk about addressing incredible gaps in terms of access in our state, not just for preschool, which has been an incredible movement for our state, but also very specifically for our infants and toddlers who have been absolutely left behind in this economic recovery. Also for access, not just slots, as it was already covered very well today, we need to address our stagnant state median income threshold for eligibility, which does not reflect what the state's policy has been around income eligibility, and the need for continuity of care over 12-month eligibility so that we make the most of that investment in that child by giving them continuity. In terms of then finally quality, the need to address, as you heard in many panels today, significant barriers in terms of infrastructure and in quality that we see across the state. One that was mentioned and covered quite well by Children Now, our colleagues, is the need to continue to invest in comprehensive quality improvement systems across the state. We made incredible movement in the last few years to move from siloed programs that are funded at the local, state, and through federal funds, but now is the time to continue to progress with a comprehensive professional development system that reaches all kinds of care and to the care providers in all settings so that we can make sure we make the most of each state investment in that slot. And we would urge that we do that through the quality rating and improvement system block grants in this current budget year and move forward. We also are endorsing the need to create a system connectivity between all of our programs through the R&R network proposal for their data project. We think that's an absolutely crucial use of one-time and ongoing dollars to think about how we move forward from a system of disconnected child care programs to thinking comprehensively about the entire child care program. Thank you.
Okay, thank you. With that, we will go to, I don't have any questions for any of the panelists, but thank you for providing some more color to the overall issue that we're grappling with before the final May revision. So thank you. Public comment?
Hi, my name is Erica Erickson.
We're going to ask, by the way,
oh, sorry.
60 seconds.
Okay.
1 minute.
My name is Erica Erickson. I am the coordinator of the Local Planning Council in Marin County, one of the counties with the highest cost of living in our state. I'm also a member of California Association of Child Care Coordinators and the California Coalition for Equity in Early Education. Today is Equal Pay Day, and we would like to highlight that funding for early education is an equal pay issue, is a women's issue, and we support the joint early childhood education letter and request and the Legislative Women's Caucus request for $800 million additional investment in our child care system. Thank you.
Thank you.
Tim Fitzgerald, Los Angeles Universal Preschool. We thank and support the Women's Caucus. We thank and support this committee on its action today. Clearly, it's about slots and rates and quality. I do want to emphasize the one-time money proposal that Early Edge talked about in terms of workforce development, mentoring, and coaching. We're only as good as the people who work with our children. Thank you.
Thank you.
Hi, Sherry Springer with Californians for Quality Early Learning, CEQUAL. We're a membership-based organization with over 1,600 private child care center-based providers. We support the Women's Caucus and the ECE community in the increase in rates, slots, SMI, and the 12-month eligibility in the mixed delivery system. CEQUAL recommends that as the state moves to discussing changes in early education for children 0 to 5, that private center-based providers are included in these discussions going forward, and that many private providers are Title V contractors. They provide care for private pay and for the voucher system, and they are included in the QRIS system. Thank you.
Thank you.
Monique Ramos on behalf of First Five Los Angeles. Here and also a member of the Early Learning and Care Coalition. And we'd like to echo and support the comments that Aaron Gable made on behalf of the coalition and essentially said that we can't repair the system or do anything unless we actually resolve rates. Thank you.
Good afternoon again. Khadija Alam Javed with the Advancement Project. First of all, we'd like to thank you for a thoughtful agenda discussion and for rejecting the administration's current proposal today. I don't think there's anything discussed here today that we disagree with. Everything discussed today is extremely important and needs additional investments, from consolidating and increasing reimbursement rates to increasing access by adding additional slots to updating the eligibility criteria to improving and adequately funding quality programs. We also thank the Women's Caucus for their audacious one-time funding proposal of $800 million and support it. We urge for us to think about a 2 to 5 year comprehensive implementation plan with a similar level of funding over the course of multiple years, which would include infant and toddlers. We would love to work with you and your staff to help create such a proposal that will keep these elements in mind. Our state should strive for more access, not less, and we certainly shouldn't consider any plans that kick out our one cohort of kids to pay for another. If we want to take actions to fix our ECE system, we should do it right. And Mr. Chair, I have to thank you for your leadership on ECE issues since day one, since you took office. So thank you, and we look forward to working with you.
Good morning again. Patty Herrera representing Early Edge, California. We were signatories to the ECE Coalition letter, so I won't belabor the request that we made in our letter. I would like to just take an opportunity to underscore our president's earlier comments about the need and to invest in one-time dollars in the early education workforce preparation and development. We think that's a critical investment for the state. We think that's a high leverage investment for the state and a wise one to make. So thank you very much.
Hello again, Robin Layton, Educational Enrichment Systems in San Diego, and I also would like for your support of the Legislative Women's Caucus rate increase, especially for the Title V programs. I have a chart here that I'll pass out, demonstrates the inequality in rates for early education providers in California. It is for San Diego County. A lot of talk about professional development for our staff. I currently have 130 budgeted positions. I have 37 vacancies. All of my staff are professionally trained. They just need to be getting paid a professional wage. So I would just urge that we not talk about increasing slots. We not talk about professional development for Title V programs. We need to increase the rates so we can pay them a professional wage. The other side of the chart also demonstrates for you how families are coming out now quickly because of the minimum wage.
Let me ask you a quick question, Ms. Layton. So what do you define as a professional wage? And what, you're San Diego, so what's your average wage?
Right now, my teachers that have bachelor's degrees are getting paid between $11 and $14.50 an hour. And professional wage probably would be starting at $40,000 a year. Mm-hmm. The rates that the Title V programs are getting, we're about 40% below what we need to be. We have I have 22 schools. I have in San Diego, we have a great quality preschool initiative that helps us pay for all of our books, our supplies, our renovation and repair. What we have is a staffing crisis because we can't pay them. I just lost somebody to Costco for $17 an hour with benefits. So it's all about rates right now.
Thank you.
Thank you.
Hi, my name is Lisa Wilkin from Child Development Consortium of Los Angeles. We're a Title V provider. We have about 500 children every day. 91% of my budget is payroll and related costs. 98 of my employees are college-educated classroom staff who earn between $10.10 and $14.44 an hour. These are poverty wages for my teachers. My teachers are eligible for the services that we're providing at our child care centers. Jobs are open for months because we can't find qualified staff who are willing to work for the amount of money that we're able to pay. We request that you adjust the standard reimbursement rate to reflect the recent and future minimum wage increases in California. Unfortunately, child care wages are benched by the minimum wage, and I thank you for your time.
Thank you.
Morning, I'm Trudy Schaefer, representing the League of Women Voters of California. I'd like to echo the thanks of others who have expressed their appreciation for the thoughtful, very informative hearing you've had today. And I'd like to say that we strongly support the Legislative Women's Caucus proposal for an additional $800 million to begin to repair and reinvest in early childhood education. Thank you.
Thank you.
Good morning. My name is Monica Walters. I'm the CEO of We Children's Services in San Francisco and also a member of the California Coalition for Equity in Early Care and Education. What you're seeing right now is documentation from our teachers throughout San Francisco, very graphically showing you what they're up against in terms of being able to both continue with passion the careers that they've started and want to continue, but also cannot afford to live in a high-cost county like San Francisco, given the rates that were being reimbursed in Title V, to be able to pay a livable wage. This is an economic inequality issue. It's also a significant issue for women of color in both in San Francisco and across California. It is with great pride and support that we are here to thank you for your efforts in ECE as well as to support the Women's Caucus.
Thank you.
Good morning. Nina Boothie, California Child Development Administrators Association. I would just like to echo some of the sentiments that were made earlier today, specifically about rates. Since its inception in 1980, the standard reimbursement rate, although child development programs are statutorily obligated to get the same COLA as the K-12 system, we have not been getting it. And so due to the freezing of the COLA over the years, we're actually 28.6% down from what we should have been had we gotten the COLA each and every year. So I think some of the real realities about reimbursement rates, both on the RMR as well as the SRR, really are at a crisis mode right now, and we really do need major investments. The committee, the assembly, has been very supportive of early education programs throughout the years, but we do need more than just a 5% increase this year. Also want to reiterate the issues around the minimum wage increases going on. Although we're very supportive of minimum wage increases, we have a major issue with families being able to in coming years due to the increases in minimum wage. So really encourage the Assembly to look at that as well as the rates this year. Thank you so much.
Thank you.
Good morning.
Over, so now you're talking to me over here. Okay.
Good morning. Beverly Yu with UDW, AFSCME Local 3930, in support of the Women's Caucus proposal. Last week, the historic $15 minimum wage bill was passed and signed into law. The majority of minimum wage earners are women and will significantly benefit from this increase. However, family child care providers were not included in this proposal. We strongly urge the committee to raise the rates paid to child care providers to reflect the $15 minimum wage increase. This would substantially improve the quality of life for thousands of workers who help care for California's children. Thank you.
Thank you. Next, please.
Hello again, Laura Magnusdotter with Community Child Care Council of Sonoma County. We run 13 Title V funded preschools in Sonoma County, And we also have an alternative payment program. We strongly support, like everybody else here, the Legislative Women's Caucus proposal, particularly the rates for Title V programs to support professional wages, increasing the SMI 12-month eligibility, and funding the infrastructure around a quality preschool. Thank you.
Thank you. Next.
Hi, good morning. My name is Elia Fernandez, and I'm with Parent Voices in San Francisco. And I'm a grandmother of 5 children. One of my granddaughters, she could afford childcare, but my other daughter, she can, and she has 4 children. And for 20 years, I've been coming here to speak to the legislative and to support to access childcare for more families. That includes making sure that there are enough slots and updating eligibility by updating the SMI and supporting 12 months eligibility. It is time to make our children share in economic prosperity. It is time to support working parents. It is time to reinvest in childcare. Thank you.
Thank you. I also have 5 grandchildren. So.
Oh, okay. Thank you.
Mm-hmm.
Thank you. My name is Maria Lustori. I'm the organizer of Parent Voices in San Francisco. Last week we were at a family advocacy summit in Washington, D.C., attended mostly by mothers. And I remember President Obama saying that childcare is not just a woman's issue, it is an economic issue. One of our presenters, who is actually a dad, said, like, if fathers gave birth to babies, maybe we would have childcare for every child. But anyway, so one of the studies presented in that forum was that poverty is neurotoxic. And when we translate that, in California, women have higher rate of poverty, and even higher when it's mothers with young children. And it was also proven that children who are the more impoverished family is, the less resilient children are. But quality childcare settings fixes that. It improves the chances of the children. And so this year our theme is It Is Time. For 20 years I've been organizing Parent Voices. Every year we come back here. We've been through up and downs, and now we're in economic recovery. We have $10 billion more chances of making sure that we provide and improve and make childcare whole again. During the recession, we got our biggest cut for childcare, and I think it's time to revisit that and really make sure that all of those that were said previously will be addressed. I think it is important. Our children cannot wait. It is time. Their bones are growing. Their brains are wiring connections. It is time. Their social and emotional development are progressing. Knowing the results of studies after studies, it is time to make childcare available to as many young ones as we can. It is time to do right by our children. It is time to stop putting on hold their full and well-rounded development. We have 300,000 more reasons. Those are children on the waiting list. Thank you.
Thank you very much. By the way, I also, as a man, had 3 children as a single parent and dealt with childcare, so it's not a woman's issue. So.
Exactly.
Okay, so, but if we could keep this to 1 minute apiece, please. Next, please.
Okay. Good morning. My name is Shakima Stoney. I'm a preschool teacher in San Francisco at Faces SF. And early childhood education is in dire need of funds. From personal experiences in childhood and early childhood, you are dealing with so many requirements. You are dealing with DRDPs, you are dealing with deadlines that you have to make for these children, achievements that you have to make for these children, but you're also dealing with no materials. And when you're dealing with no money for materials, you can't teach these children the things that are in DRDPs. And if you can't teach them the materials that they need and the statuses, that the standards they need for DRDPs, they won't reach that mark. And that leads to another issue where you have to come out of pocket. Some teachers can barely afford to live in San Francisco. How can you tell them to reach into their own pocket, as much as they love children, to pay for these materials, which costs $50 for like a box of crayons nowadays, maybe, so that they can teach these kids. So we, one, need more funding for schools, for supplies, and we, two, need more funding for teachers, that if our supplies do dwindle, we're not taking $50 from our rent or $30 from our groceries.
Thank
to
you very
help
much.
Kids. Thank you.
Thank you. 1 minute, please.
Hi, my name is Markenia Broughton, and I'm also from Faces SF in Bayview. I'm not just a teacher in Bayview. I'm a mother, a sister, a mentor, and a friend, a counselor, just to name a few. Money is needed for child care providers, not for the many roles we take on, but for the reasons of being the first educators after parents, helping molding children before kindergarten, and pushing kids through high school and extra support. Thank you.
Thank you very much for your comments. Next, please.
Hi, my name is Jason Yabbitt, also from Faces SF. I'm a preschool director, just supporting teachers. Quality teachers is vital to early child development. Teachers build powerful, positive relationships between children, and that support is so vital to children and their families. I feel that supporting low-income families and seeing their struggles be absorbed by young children at an early age, the children are already falling through the cracks. And it takes really caring, supporting, loving early childhood educators and teachers. However, great teachers are not only really hard to find, but hard to keep. Early childhood educators not only lack the wages, but also lack the support to do their jobs. Investing in early education is a key to children in developing success. Thank you.
Thank you very much, sir.
Hi, Christine Lay from Faces SF. I'm also a preschool teacher. I just want to say that the high cost of living in San Francisco has sometimes made me reconsider being a preschool teacher, just because it is such a struggle with how much we get paid and the amount of work that we do. I'm very dedicated and passionate about serving the children and the families that I have, and because of that, I actually have a second job. So I'm here to advocate for the teachers for higher pay, more funding for the programs that we provide for the children and families in California. Thank you.
Thank you very much for your comments.
Good afternoon. My name is Kathleen Martinez, and I am here on the behalf of Parent Voices and many parents as mothers and fathers. I want to talk about the SMI, which is the state medium income. And I want to talk about when I was a parent, how I had a job. And in this job, it was a 25-cent raise because the state medium income had not been unfroze or changed in many years. I ended up losing my child care, and then I didn't even have a job because I couldn't take the child care. So I gave that 25-cent raise back so I could have my job and have the child care. Well, then later they tried to give me $1 raise, and I couldn't take it. Otherwise, I would have lost my child care. And what I want to talk about is my children are raised. Not one of them have been on welfare. And here my daughter is in the same situation. She's been on the list for 5 years with my granddaughter, and she can't get it because she's $60 over any help. I just want to speak that today I hope that you support in changing that SMI. Thank you, and you have a wonderful day.
Thank you very much for your comments. Yes, ma'am.
Hi, Parent Voices California. So we talked a lot earlier today about childhood trauma and the negative impacts of childhood trauma. And I just want to sort of talk about the trauma that parents are facing every day as they wait on a child care eligibility list, hoping that their day will come, that they will finally have the ability to take that job or take that class at college. I want to talk about the trauma that they face dealing with the countless mountains of paperwork that not having 12-month eligibility creates. I want to talk about the trauma that providers face, that they don't have a living wage to be able to care for their own families, and we're expecting them to care for our most vulnerable children. I want to talk about the trauma that each and every child faces that doesn't have the opportunity to have that experience of a quality early learning program and what that means to their future success in life. Please stop this trauma from happening to these families and invest in these programs. $800 million that the Women's Caucus is asking for is a great start, but until we fully fund all children in our state, we have work to do. Thank you.
Thank you very much for your comment.
Hi, I'm Terry Cedric. I'm from North Coast Opportunities, which is in Lake and Mendocino counties.
and I run an alternative payment program. I've been with the agency for 27 years, so I've seen a lot of changes in those alternative payment programs. Families and kids are still the same. They need us. They need your support to make things better for them. I've seen with the alternative payment program, we used to get a 25%, 75% out the door as far as for staff and staff to give the parents what they need and the services they need, and to be that person there, that coach, that mentor, to help them get out into the job world, into the marketplace where they can help pay back and invest their taxes back into the system. I hope that you see childcare as an investment in our future. Thank you.
Well, we know it is, so thank you very much. Are there any other comments? Seeing none, I'll close. Yes, I'm just going to close the public hearing, though, right? Okay. I got to add on? Okay. Yes, I'd like to add on.
Issue 4, Chavez.
Aye. Are we done? Done. Thank you, everybody, much for participating today. This will close the meeting.
Meeting adjourned.
Meeting adjourned.